I'm Drew Shannon.
Hey, what's your favorite fruit tree? Well, it makes no difference because at Bob Wine's Camellia Garden this week, it's a BOGO on all fruit trees. Take your pick. Peach, pear, mulberry, chestnut, banana, and more in the big number 5 size. Regularly $59.99. $59.99, but you buy one and you get one free. Crepe myrtles, Bob still has them. Smaller ones start at just $4.99 and go all the way up to the super jumbo crepe myrtles. That's the number 20 size for $2.99. And you buy one, get one free, delivered, planted, and guaranteed. Now that's a deal. Every day you get Bob's ever-blooming azaleas, your choice, just $3.99. Got a landscape problem? Let Bob fix it. Bob Wine's Camellia Gardens, Southeast 38th Street in Ocala, daily till 4:30, in the same blooming place since 1952.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
Listening to AM Ocala Live, WOCA, The Source, 96.3 FM, 1370 AM, broadcasting to you live from the Paddock Mall, streaming live, YouTube Live, WOCA, The Source Radio, moving through this Wednesday, currently 75 degrees out there, a little cloudy. The expectation, a little bit of a rain. But we're moving on with this Wednesday, as it's been a little bit busy here for us. Good show. And up next, I have here on the phone Dr. Norman Lepor, Director of Clinical Research, Westside Medical Associates of Los Angeles. And this is some good stuff here. As much as we've been talking about the tumultuous time of 2020, a new clinical trial is currently underway for an existing and inexpensive medication that may stop the progression of COVID-19. Some adults who suffer from major COVID-19 complications appear to present a major inflammatory storm. Therefore, researchers hypothesize and are targeting the inflammatory response that may reduce COVID-19 complications related to this risk. And with that, we have the doctor on the phone to talk about it. Good morning, doctor. How are you doing today?
Good morning, Adam, and thank you for the opportunity to let your listeners know about some important opportunities.
Absolutely, and we brought you on here to talk about these opportunities, and this is the opportunity, like we said, to may stop the progression of COVID-19.
Thank you. So let me just give some background. Why are we doing a trial? Why are we doing, and the trial is called the Cold Corona Trial. It's actually directed by a colleague, Dr. Jean-Claude Tardif at the Montreal Heart Institute, and it's actually sponsored by the NIH and the Bill and Melinda Gates Foundation. So why are we doing this clinical trial for treatment if we hear about all these clinical trials for vaccines? Well, first off, 75,000 new cases per day are diagnosed in the United States. Patients who go on to develop complications of COVID-19 are being hospitalized increasingly, filling up hospital beds, filling up ICU beds, being placed on ventilators for weeks at a time, and some are dying. There is no directed medical therapy for COVID-19 for outpatients. Basically, you go to a testing center and they tell you that you are infected with COVID-19. You're basically given the following advice by your physician: stay at home so you don't get others infected, and quarantine, stay hydrated, and treat your fever with Tylenol, and if you get sick enough, go to the hospital. So there is no treatment that prevents the progression of the complications of COVID-19 to avoid hospitalization. So that's why there's a need for that type of treatment. And what we're doing in this clinical trial is we're comparing colchicine to those supportive treatments I mentioned to see if colchicine actually prevents the progression of this inflammatory storm that was mentioned that leads to the hospitalization and to the complications. Now, what's really interesting is that colchicine is a drug that's been around for hundreds of years. It's currently being used to treat gout and to treat inflammation around the heart as well as other conditions. So this is a drug that's easy to manufacture. It's widely available. Physicians and other practitioners are very, very knowledgeable about it, so it's easy for patients to access. And there is some evidence that the drug may work, and I want to emphasize the word may, in terms of preventing the progression of COVID-19. And hence the clinical trial that's going to compare it, colchicine, to placebo, meaning the placebo patients would still have to quarantine and get fluids and Tylenol, and to see if colchicine makes a positive difference in terms of the outcome of these patients. Because if you don't do clinical trials, then you won't know if something is snake oil or effective. And I will tell you that every medication, every prescribed medicine that a patient has taken has gone through clinical trials in order to determine their effectiveness as well as safety. And what we hope to do through your work, Adam, is to be able to increase the awareness of the clinical trial so that those patients who, number one, have received the news of being infected within 48 hours, who are 40 years of age or older, and are not hospitalized and have not been hospitalized, they would be candidates for this clinical trial. And what's beautiful about this clinical trial, it's called a no-touch clinical trial. That means patients don't have to go to their doctor's office. They don't have to go to a clinical trial center. I'm going to leave a number for them to call, a hotline that's manned 24/7, as well as the website. All this is done on the internet or on telephone, and we even have a courier if you're located within 4 driving hours of a clinical trial center that will actually deliver either the drug or placebo. We won't know. We're blinded, and it's randomized to the patient. Now, what happens, interesting, sometimes patients say, well, I don't want to be in a trial that I have a chance of getting a placebo. And, you know, it's kind of a silly question. It's a silly answer, because if they don't participate in the trial, then they have a 100% chance of being on placebo because they're not going to get the drug. That's right. Plus, we're not sure if the drug works. So we need to find out if the drug works, so we avoid the confusion that we have now with hydroxychloroquine. Some people swear it works, some people swear it doesn't work. So there's a lot of confusion, even in the medical community, regarding it. And this is what we want to avoid.
Gotcha. Now, after a patient is diagnosed, what's the first thing that they should do when it comes to being interested in this?
So what they should do, and I'm going to give, if they can get pencil and paper, because I'm going to give both the hotline number, which is manned 24/7, as well as a web address that they can go through and get all the information in terms of whether or not they're a candidate for the trial, whether they're interested in being in the trial after hearing more information, and whether they're within 4 hours driving distance from the nearest clinical trial center. The hotline number is 877-536-6837. That's, again, area code 877-536-6837. The website address is colcorona.net, COLCORONA.net, and the clinical trial is called the Col Corona Clinical Trial.
Gotcha. Excellent. Now, this is something that we're saying, just to reiterate for those maybe tuning in, it's the idea of what we can find out as a way to be treating COVID-19, correct? It's the idea that there really isn't much out there right now, but the only thing we can mention is like convalescent plasma as being the only thing.
Right, and even that's only given to patients for the most part who are pretty sick in the hospital. So, this is really a treatment that's geared towards early COVID-19 before they would even need to receive that kind of therapy. So the object is to prevent the progression of the disease, so they don't need to be hospitalized, so they don't need to be put on the ventilator, which can be 3 or 4 weeks, and don't get some of the complications that we're now seeing that affect the heart, the intestines, the brain, and really try to tame this lion, this lion called, COVID-19, and really tame it so that it can behave more like a flu infection, which is certainly not nearly as bad and less than what we're seeing in terms of all the complications and the mortality associated with COVID-19. Even if we do get a a vaccine, there's still going to be a need for treatment because, number one, the vaccine is not going to be available probably till the beginning of the year. It's going to take months for the vaccine to be distributed to the 300 million, plus Americans. And number three, not every vaccine is 100% effective. They, it could be 99% effective. It could be 50% effective. So as vaccines, as good as they are, and once they're available, I would highly recommend that your listeners take advantage of it. There's still going to be a need for a treatment now because we don't have a vaccine, and even later on because some patients may not respond as well to a vaccine.
Absolutely, absolutely. Well, thank you for the time, Doctor. This is interesting. This is new news that we'd like to hear. This is something that could be drowned out by everything in media right now. So it's a pleasure to have you on and to spread this information to maybe see something be different, but in a positive way moving forward. Now, for more information, as mentioned, 1-877-536-6837. As you said, that's 24/7 is that phone hotline, and then you can visit more on the net at colcorona.net for more information and to see if you fit the criteria and all that good stuff. So we appreciate it, Doctor, as the Director of Clinical Research, Westside Medical Associates of Los Angeles, Dr. Norman Lepor. We appreciate it, sir, and hopefully you guys can get more and more of the people that can contribute to the trial and see where we go from here.
Thank you, Adam, and thank you for providing such an important public service.
Appreciate it. And you guys have a great day and a good rest of the week. WOCA, we're back right after this.
Senator James Lankford tells Fox Business Network.
The main goal that I have is to make sure we're targeting funds towards those who need the help the most and not pouring somebody else's